Welcome to Courageous Living. I'm your host, Kiki Ramsey, and on this show, we strive to help you get courageous in everything that you do. Today, I'm so excited about our topic. We're talking about how to raise successful children in today's society. Now, our children have so many things going on in their lives, like drugs, sex, peer pressure, you name it. Well, today's guest is going to shed a lot of light on how we do raise our children successfully in today's society. So don't go anywhere right after this. Welcome back to Courageous Living. I'm your host, Kiki Ramsey, and I'm here with my guest, Miss Kelly Hubbard. Thank you. Welcome to the show.
Thank you.
Welcome. So listen, you have a daughter. She's a preteen. Tell me about her.
Yeah, so she's 10 years old, 5th grade.
Oh, what's her name?
Lauren.
Lauren, okay.
Yes, yeah. Middle school next year, so, you know, we're getting ready for all the changes that come with that.
Absolutely. So today we're talking about how to raise successful teens in today's society. And so you have a preteen, so she's going into this whole teenage life of hers.
Absolutely.
And everything like that. So why is it really important for you to even learn about how to raise her?
Yeah, so, you know, it's different now. It's not like when we were growing up many years ago, and there's a lot of different influences, a lot more pressure with the outside influences, and so it's just really important for me to, you know, I don't want to be perfect, but at least, you know, get a little more tools under my belt from my husband and I.
Yeah, I mean, I totally understand because I have a son, and he's 18 years old. And I know we were talking on one of our breaks about just raising our teens and how you're scared. A lot of parents have told you all these horror stories and everything about teenage life. And I mean, I even went through that in my own life with my son. As he grew up, he got into certain things like peer pressure and wanted to fit in and all those things. Do you feel like you will even have to deal with that kind of thing?
Absolutely. Absolutely feel like we'll have to deal with that. Starting to see glimpses of it already. She's really good about kind of doing her own thing, but, you know, as they get older and start making more friends, you know, you can kind of see, well, so-and-so's doing.
Right.
And you know, you'll see kind of things happening with her friends, and all of a sudden she'll do that. So yeah, absolutely, I think that we will have to deal with that as well.
Absolutely. When you say friends, I think that's one of the biggest things. Friends and peer pressure and wanting to fit in. And I saw that with my own son. He wanted to fit in. We would have arguments about clothes and shoes and what to wear and what not to wear. Have you even seen that in her?
We're not having arguments, but because she usually will say okay, but we are kind of, you know, butting heads a little bit about what to wear because we're very, you know, particular about what she should be wearing. And of course, you know, you're seeing things on TV, or some of the other young ladies are wearing, you know, the short shorts and the tight stuff, and you're like, no, you can't wear that. And she feels like if it's in her store, it's okay.
Oh,
so
yeah, absolutely, absolutely. I'm glad you mentioned that, because the thing, when I say in today's society, you know, it's really, really difficult, because when you look at a magazine or when you look at television, young people look different than what they might have looked a long time ago. I know for when I was growing up, we used to do different things, and now it seems like the kids are really into the short shorts, or the different hairstyles, or the tennis shoes, or just wanting to fit in. And I found it a real big deal when I was growing up to want to fit in. You know, for our children to want to fit in. With her and everything that she's going through in school, what is your fears when she goes to middle school? Because that's a whole different topic.
Yeah, exactly, and that's kind of, you know, what we want to talk about, because middle school, you're right, it's going to be a lot different, probably a lot more pressures, right? Right now, they're all still young and still kind of kiddie, but in middle school, and we're starting to see that transition a little bit now, where they're transitioning from the little girl to more of a young woman, bodies changing.
Oh, absolutely,
and things like that. So yeah, so it's scary, actually.
Right. Have you had to have those conversations. We call them the conversations,
right?
because, and it's like between a mom and a daughter, you know, your body is changing, you know, things are starting to happen, and those conversations, is that scary for you?
The conversation itself is not scary for me, the result of the conversation, right? So I know there's no right or wrong answer, but I'm trying to get it right. Like, so so I'm calling friends and you know, reaching out to sisters and things like that. Like, okay, so what do I say?
Right.
You know,
yes, absolutely.
You know, that's where I struggle.
Yeah.
You know, I don't have a problem. I want to talk to her. I want to keep those lines of communication open. It's
key.
just making sure I say the right thing, not to terrify her, but to make sure she gets the information she needs, and also that she'll still come to me, because I also don't want to, you know, just kind of be like, don't ever do this.
Right. And I think that there is a thin line at some point, maybe, where we are too rigid. I know the whole thing is we are not our kids' friends. We're not their friends. And so I still think there's this fine line between not being their friend but also being their parent, so that they do feel comfortable coming to us. And I think that if you're building this open relationship with her, like you seem to be building, that she'll want to initially, you know, come to you. I know with my son, I tried to build this relationship so that he would come to me. Even though he's a boy and he could go to his father, I still wanted us to have these open dialogues between us so that he could feel comfortable. But there still came a point where he didn't come to me. You know, and so there's going to be that point. I think that you don't have to be perfect. You know that, right? Because none of us is perfect. None of us really knows all the answers. And the other thing is our children. They are absolutely not perfect, but learning how to deal with them and keeping those lines of communication open is certainly the key when it comes to raising our kids in today's society. So what things is she looking forward to when she goes to middle school?
Well, she's looking forward to kind of after-school activities, you know, socializing a lot more. She's looking forward to those things.
Right.
You know, changing classes is a big deal.
Absolutely, absolutely.
Yeah, so those kinds of things. The normal, you know, school dances. She had her first school dance this year.
Oh, wow, congrats.
Yeah, so that was exciting for her. So she's kind of looking forward to those things. And then on the other hand, she's kind of like, oh, you know, it's just another grade.
Oh, yeah.
So,
yeah.
I don't think she really understands that middle school is a little different. So,
and we talked about how resilient kids are. You know, they're much more resilient than us as it pertains to change and everything like that. How resilient are you going to be when she goes to middle school? How different is this going to be for you?
Yeah, that's a very good question. I'm not sure how to answer that. My husband and I talk about that a lot, you know, just how we deal with it and trying not to, I guess, put ourselves on her, right? So things were a lot different when we were younger. And while we want to do some of those same parenting styles, we have to acknowledge that reality is, it's different.
Right,
now.
absolutely.
And so trying to change that mentality. I think probably the biggest change for us is going to be her independence.
Hopefully we're going to get into that piece when we come back from break. Thank you so much for being here with me on this first segment. It was so awesome. But when we come back from break, we're going to be talking to Dr. Jeri Dyson, and she's going to really shed some light on how to raise our kids successfully in today's society. So don't go nowhere right after this. Welcome back to Courageous Living. I'm your host, Kiki Ramsey, and I am joined by Dr. Jeri Dyson.
How are you?
Good. Welcome to the show. Looking all gorgeous and stuff.
Thank you. Thank you.
You are a adolescent medicine physician.
Correct.
Tell me exactly what you do. We're also joined back by Kelly. I didn't want to forget you. Let everybody know that you are still here with us because we're going to be talking about how to raise successful teens. So tell me exactly what you do.
So adolescent medicine is a field where we take care of teenagers and preteens.
Okay.
So anywhere from 12 to 25. Those are our patients, and we take care of them in every aspect. So if it's asthma or high blood pressure, obesity, just routine well care, that's what adolescent medicine physicians do.
Okay, so you do a lot.
We do a lot.
And you see a lot.
We do a lot and we see a lot. And my subspecialty is sexually transmitted infections. So it kind of overlaps where teens are more risk-taking behavior, so they're more prone to sexually transmitted infections. So that's my area of specialty.
Okay, so I can see how that's really important because I have a teen who is 18, and so that can be a very, very important topic. And I love it because Kelly is here and she has a preteen, but she's 10, but she's going into middle school. And so that's that dynamic changes everything. When you go from elementary school to middle school, everything changes. And so in your practice, there's still some young people who are middle school going into high school.
Exactly.
What's that transition like? What are those problems that you're seeing in those teens?
Well, it's multifactorial. I think some of the problems that we see in transition is, like you all talked in the earlier segment, the parents trying to release their younger person because they're gaining independence. You want to give them some autonomy, some independence, but you don't want them to just be shipwrecked. So it's finding that balance for the parent. So the transition that's hardest for the teenager is actually learning that autonomy, learning how much to do, and also trying to find their place. Everybody mainly is trying to fit in and express their own individuality at the same time. Like, you don't want to fit in so much where you become a clone, but you also don't want to stand out. So that's really the lane that those teenagers are really struggling with. But it's okay if they do stand out to the point where they don't fit in. I know that's double talk, but that's basically that's what makes it so hard for the teenager, honestly.
No, but I think that's so key, but I think that's what makes it so hard for the parents. I mean, Kelly is just as much as they don't want to stand out or they want to fit in and they want to stand out a little bit and have their own autonomy and be their own selves. It's so hard for us as parents to kind of let go. So what kind of advice do you have for her to say, hey, she's going to middle school?
And I think a lot of it is just knowing your child, knowing the relationship that you have with your child. Each child is different. So you can have multiple kids, but each child that you have is going to have a different temperament. They're going to respond to things differently. So the main thing is just knowing your child up to that point and helping them as they transition on a day-to-day basis. So if you notice that your child normally was very talkative, interactive, and then they come home, they're not as talkative, they're not as playful, they're not as happy. Those are the kind of things that you want to try to focus in on a little bit and try to pull more conversation out of the child. You don't want to like go in all like Rambo, but what you do want to do is just make it where they feel like they can come to you and talk about any and everything. And I think for the parent, the hardest part is us maintaining the open conversation where we don't look too shocked when they're telling us stuff. I think that's the main thing. Because as kids are talking to us, what they do is they look at your whole body language, they look at your facial expression. So if you're looking shocked and awe, they're like, you can't handle this, and they shut down.
Have you had that, Kelly?
No, because I do try my best to focus on it. I mean, I've had a couple of instances where I am holding back extremely because I'm like, just listen. You have to do that inner self-talk.
Exactly.
And I don't know if I pulled it off is probably the question, though. My face probably did tell her something else.
And you'll know because they'll want to come and talk to you about more things. And the thing you do is you want to throw it back to them gingerly and just say, so what'd you do in that situation? Or how did that make you feel when that happened?
That's
just
really good.
Just to kind of get them to talk to you a little bit more. And then you say, well, depending on what they tell you, that's good that you did that. I would also add that you may want to try this next time if it happens.
I love that because you're saying talk to them in terms of suggestions. Like we're still the mom, we're still the parent, but yet still you're more so suggesting so that they feel more comfortable. Like, oh, she handled that situation okay. well, maybe I can talk to her about more stuff that I have on my plate.
And you also want the child to feel like part of it is their idea. It's not manipulation, but remember, they're in that phase where they're trying to gain autonomy.
Right.
They're trying to gain that independence.
Right.
So if you're still telling them what to do in every situation, and you might get some resistance and some rebellion in that way.
Yeah.
Whereas if you just make a suggestion like, well, you may want to do this the next time, or handle it this way, and we can continue to talk about it as time progresses. It just makes it more of an open dialogue, because there is no one conversation about anything. There is no one conversation about sex, one conversation about drugs, one conversation about friends who stab you in the back or whatever. You want to have it so it's a consistent dialogue over and over.
Absolutely, and I think that's so key that you said that, because I know in my case I've had to have the same conversation over and over and over again. Well, let me ask you this. Okay, so we're talking about teens. They're very impressionable.
Right.
Society, the media, oh my gosh, the media tells them one thing, that it's cool to have, sneakers of a name brand, that your clothes need to be all name brand, that, it's okay to wear makeup at a certain age, it's okay to date. Sex is totally downplayed in today's media. As a parent, dealing with what the media is telling our children and at home, how do I go about really trying to raise them despite what the media is saying to us? Because that's the difficult, and that's really where we are nowadays.
And that's the thing that really puts people in the tizzy when it comes to, okay, this is what we do at home, and this is how my expectation of you is to act in public. But what happens is, remember, the teens are also trying to fit into their society. So with fitting in comes, you have to have the name brand, you have to have the shoes, you have to have this. But to counteract that, what I normally tell my parents is to really focus in on having their child understand the importance of who they are without the things. And that's the hardest part, because it doesn't start at teenager-y years. And that starts, like you're dealing with your daughter, Kelly, that starts when they're a lot younger. You want to kind of introduce them the importance of who they are as a person, without the stuff, without the name brand, without the shoes, without the makeup, about how valuable they are, how important they are, how their brain and their activity, their creativity. You want to really focus all of your energy as parents on who they are as a person, what they bring to the table. So that way they don't build their lives on things, because if they're a teenager doing that, we know adults that do that. Adult women who go crazy over handbags or makeup, or I have to have this, or we have to drive this kind of car. And so it grows if we don't deal with it. And the main focus is letting them know who they are and as an individual.
That is so, so key, because, Kelly can probably attest, when our kids are growing, they are very impressionable. And my son, he was so impressionable. He wanted to fit in. He wanted the nice shoes. And even though I tried, I still think some things still seeped over to the other side, because he still wanted those things. It's not that he didn't want them, but my hope is that as he's gotten older, that those things are not more important than the relationships that we're building in our home. And I think that's really what's key. But I think that a lot of people look out at society and they're like, oh, I want my kids to have that. So that's the question I have for you. How do you as a parent, I as a parent, Kelly as a parent, still instill those values in our children, but yet still let them not want for anything? You see what I'm saying? Like, our children want, and we want for them also. We don't want them to not fit in because they don't have, but we don't necessarily want to give to them all the time just to fit in. How do you balance that, our wants and their wants and needs?
And I honestly, because that question has so many layers to it, but I think that it's okay for us to let our kids know that if you don't fit in, that's okay. And I think me being raised as, I was an only child. And so you get used to being by yourself. So you're like, okay, if I don't fit in with this group, I'll just go to the next group. Okay, if I don't fit in with that group, I'll go to the next group. To let our teens know that it's okay to be you. Just express yourself.
Right.
I think so much we're trying to get them to fit in this box until once they realize who they are as a person, why they were created, who they are, what expression they are to release into the world or into their surroundings. I think once we focus a lot on that, it'll help them develop. And so some of those wants for material things become little.
Right.
You know, you can have the stuff, but
Right.
it doesn't make you who you are.
Right.
And I think that's the key. We can all provide for our kids. We can provide nice
Right.
clothes, a nice house, the best schools, the best education. But I think once they start identifying who they are
Right,
with
right.
those things, that's
Right.
when we've done our child a disservice.
So when it comes to our children, you specialize in like sexually transmitted diseases
Correct.
and all that. Okay, the topic of sex, especially for parents,
Right.
and for children to come to us and talk about that. I don't even know, where do we even start?
Well, and that's the other thing. There is no start point.
Okay.
You have to, every moment is a teachable moment. So if the kid is singing and they're in the car and they may be singing some words to a song that they may not even know what it's meaning. So what does that song mean to you?
Oh.
What's that mean to you when you're singing that? And then you start the dialogue there.
Okay.
Or if it's in the tub, normally what I'll say to all of my patients and their parents is the dialogue starts when they're young.
Okay.
Okay?
Okay.
So you talk about appropriate touching, what's appropriate, what's inappropriate, knowing the correct names of their body parts.
Yes.
Let's just start
Oh,
there.
my
Knowing
goodness.
the correct name, because I have some young adults who don't even know the correct names of their body parts.
Wow.
So we can start there as, you know, the dialogue goes.
Right.
And then, you know, you just add on. You add on. You
Okay.
add on based on the maturity level of your child.
Right.
Based on how much they're able to tolerate. And
Okay.
sex is everywhere.
Oh, yes,
Sex
it
is in
is.
commercials. You can see
It
a
is.
shampoo commercial
Oh, yeah.
and it's sexual undertones.
Right.
Or
Absolutely.
sexual overtones, depending on what the commercial is.
Absolutely, it
So
is.
for us to ignore it and act like we didn't see that would be
Yeah.
dishonest. So
Yeah.
a good time to talk about it is during those moments.
I think that that's great. I think that, you know, with us being parents and stuff, it can get a little scary
Right.
because I think about back when I was young and the conversations I didn't have, you know, and where it led me. And I'm like, okay, I really want to have these conversations, but they're scary, especially when you have a girl versus a boy or a boy versus a girl,
Right.
you know, and Kelly has a girl. And
The thing we don't want to do, though, as parents, is talk out of our fear. And a lot of times what we do is we talk to our children out of our fears.
Right.
Meaning, I don't want you to get pregnant. I don't want you to start.
Uh-huh,
I don't
yes.
want you.
Yes.
So when we start talking like that, automatically they start getting closed emotionally in the dialogue. So because they're like, I don't want you to get pregnant. I don't want you to let this boy do this. I don't want you to get a girl pregnant. And that doesn't really make for great dialogue.
Right,
so
right.
after we as adults deal with our issues,
Yes.
it just makes it a lot easier to have that conversation. So it's just a smooth conversation. It should
Yeah.
just like we're talking about, what college do you want to go to?
Right.
It should be the same fluid
I love that.
conversation. But I think most of the angst comes from the parents.
It
because
does.
automatically, a lot of us feel like if we start talking about sex, they're going to start having sex.
Absolutely, absolutely. Even when you talk about protection or
Right.
you know that kind of thing, you think if you talk about protection, then you're giving them permission.
Right.
And I hear that all the time,
I
and
do
I'm
too.
sure
I
you
do
hear
too.
that all the time. But that you're saying that that's not the case.
That is not the case, because if a child is deciding they're going to have sex, they're going to have sex whether or not you talk about the conversation, whether or not you give them a shot, whether or not you provide birth control, whether or not, if they desire to have sex, they're going to have sex. So I think the onus is upon us to make the dialogue a comfortable dialogue, to make it not awkward, and
Right.
to make it where we're both learning. Because I learn from my teens all the time.
Right.
In our
right.
dialogue, you're like, what does that mean?
Right.
And so I think teens, if they feel like they're teaching you something, they also like to communicate too.
Right. Right.
So, but if we come to the table
Yes.
like, you know, learn from me, I'm the great wise one,
Right.
and you should get all the information from me, that kind
Right.
of closes them down for dialogue.
Right. Kelly, is this helping you?
It's absolutely
You know,
helping me.
Because
yeah.
that dialogue, that conversation with our children, is so imperative. I know that even though I am out there, I help women overcome fear and everything, but I'm still a mom.
Right.
And I'm still imperfect, and I make mistakes. And where were you when my kid was, when he was in the house? Because I know that this information that you're giving us is so valuable, because my son would tell me, Mom, why are you're so OC with some things? And I'm like, it's not for me to be OC, but I just want to be a great mom.
What's OC?
Out of control.
Okay.
Yeah, out of control, So that's what he says, and I had to look it up myself too, because I'm like, what is that? But it's kind of like you go overboard when you're talking about something, and I, not trying to be that way, but at the same time, trying to keep them safe. Trying to keep them safe.
Pull in other people too. That's the thing that we don't do. I heard Kelly mention that earlier, like I'm calling my friends, asking my friends. A lot of times we need to pull in our family members. If it's a guy, you have a son, and you don't feel necessarily comfortable, or your husband doesn't feel comfortable, let him talk to a uncle, a cousin, or the girls can talk to aunts or cousins, female cousins. Just somebody that you know who's going to have your child's best interest at heart, who won't be so anxious during a dialogue, who can give them good information.
Yes.
You don't want them talking to just anybody,
no,
but
and
you want them to have good information.
I love that. That's good advice.
That is very good
that's great, because I have a sister, and he can go to her, and he feels comfortable when he doesn't feel comfortable with me.
As long as they get the information.
Dr. Jeri, you have a book.
Yes, ma'am.
And I love it. It's called An Apple a Day Keeps the Drama Away.
Yes.
And this book is all about helping teens and young adults navigate through life.
Correct.
And I absolutely love it. And I just want to say, one of your chapters talks all about persistence. And you say, the one thing I've learned in life is that through all of our challenges and oppositions, we must be persistent.
Correct.
Why is that important?
I think persistence is so important for our generation and the generations behind us, because people look at like the 5-minute stars, like the Twitter stars, the Facebook stars, and they think, oh, everything is instantaneous, and it's not. And so people have a tendency to get very discouraged if they don't realize you have to be persistent. You have to have some stick-to-itiveness. You have to be able to, after the failure, go back and try again. Tweak it, try a different way, and go at it again. Because if you fail and then you're like, okay, I'm out of the game, then some dreams are never going to be accomplished until you are persistent. Everything is not easy. Everything is not easy, so you have to have that tenacity to go back at it, regardless of who says what, or just go for it. Just be persistent.
Oh my God, thank you so much. You guys have been amazing. You ladies have been amazing. Thank you, Dr. Jeri, for being on the show. Thank you, Kelly, for being on the show. And thank you guys for actually watching. Please go out, get Dr. Jeri's books. It's called An Apple a Day Keeps the Drama Away. We'll absolutely have all that information for you. But don't go anywhere, because I'm going to wrap this show up for you right after this. Welcome back. I'm Kiki Ramsey, and today we talked about how to raise our teens in this society successfully. And I think we learned a lot of things, but the one thing I think we learned was that raising teens successfully is not an exact science. You as a parent, you have to raise your teen by your values and your core beliefs. And if you do that, and you create an environment where they can come to you and communicate, everything is going to be okay. Well, thank you so much for watching, and I look forward to seeing you on our next show.